The Manila Times interview with Dr. Ditas Dominguez, June 28, 2020.
Doc, let's start nga po. Kamusta po yung inyo pong practice before the ECQ, before all of this happened po?
My practice was doing okay. We had regular patients. I've been in practice close to 30 years, and everything was fine. We would see regular patients, and that's it. We did not have any kind of warning as to what would happen within days, no?
Mm-hmm.
So that's about it. Yes.
Yeah. So nung nagkaroon po ng, of course, nung na-announce na po yung quarantine, yung mga lockdown sa buong Luzon, of course, what came first into your mind po when it came po doon sa mga patients po ninyo? May mga patients po ba kayo nagtanong na paano yung mga naka-schedule nila during the first week or the first few weeks nung first few weeks ng lockdowns?
Yeah, what happened was those patients that had cases were ongoing kasi sa dentistry, di ba, when you go to the clinic, it's done already. We're very procedural most of the time. Ibig sabihin, when they go, they see us most of the time, we do the procedures right away, like a filling or an extraction or cleaning, prophylaxis, and so, right? Dentures are the ones that you have to come back for. So what happened was, and this is a mix of different procedures, through the weeks and the months. Ang nangyari was that people were kind of hearing already news about what was happening in China, and it was already beginning to kind of settle in, and kami kasi allied medical, we know that. When we hear certain things like that, kaagad matunog sa amin yan. So I was a little bit apprehensive about it. I was kind of worried about schedules. But on March 14, that was a Saturday, on the 15th, I think, if I'm not mistaken, there was already an announcement from the government, and then 17 ata nagsimula, no?
Yes.
So we did not have any clue that it would happen, and everybody was caught off guard. Nabitin, madami kaming nabitin. Ako, personally, ang dami kong nabitin na cases. Yung mga pustiso na kailangan maglagay ng pustiso, suddenly, hindi magawa. Because even the laboratories, yung mga dental laboratories, they stopped everything too. So there was nothing we could do. There were some patients that were asking how it would happen, na paano yan, and they were seeing na baka lang a week or 2 or a month at the most, no? Nobody knew it would be this long. So madaming nabitin, and they were I was not really surprised. The patients that come to me are actually also health. They're very health conscious. So I guess they kind of knew that there were no really choices in terms of coming to see me kasi hindi kakayanin. Pati sila ayaw nilang lumabas. So that was it.
And kailan lang ulit kayo nagbukas ng inyong practice po?
My soft opening was June 2.
Ito lang.
Initially, I was planning to do a soft opening. Soft opening meant to me and the clinic, lahat ng mga nabitin na pasyente, itutuloy ko kasi kawawa naman ang tagal, 3 months na, no? So soft opening for a week, but before that soft opening, since it was already modified ECQ, I was able to go around to kind of get things going, like doing the operatory, fixing it, doing all the necessary fixing of the operatory area for exhaust and all that to get it ready. I was able to do that for about a week. And then on June 2, soft opening. We got in touch with those na nabitin because we have their contact details naman. And there were those that were glad to come back. There were those up to now are still very reluctant, ayaw. So walang problema. For as long as they're not in pain, hindi naman sila problematic in terms of their dental health, then whenever they're ready. But we're ready. I mean, we're ready to see those that need to come see us. We got that ready, and June 2 was soft opening, and then a week later, June 9, yun na yung official opening namin.
Mm-hmm. So,
Yes.
Yes, Doc. So, of course, during the weeks leading up to the opening, you practically parang you have to reinvent your clinic as well kasi you have
Yes,
to
of
follow so many protocols.
protocol. Yes, yes, yes. Um, I had to brainstorm. The good thing about it is I have two other dentist daughters. One is an orthodontist, one is a general practice dentist like me that does cosmetic dentistry. So
Mhm.
in the house where we live, we do meetings, we come up with ideas as to the
Mhm.
protocol, and the Philippine Dental Association was very helpful all the way. They had done the guidelines to help us in cooperation with Department of Health. And so, with all of their efforts, PDA came up with guidelines as to how we would better keep everybody safe, and well from all of this, yung existing problems natin while they come to see us. Or if they cannot come to see us, may mga guidelines. So it's easier to decide kung ano yung pwedeng makita, yung mga hindi po pwedeng makita muna. So magaling ang PDA, ang galing. Very good. President Almonte.
Mm-hmm. Can we elaborate po kung ano po yung mga steps na ginawa ng PDA ng PDA for the resumption of yung mga dental practice, dental clinics, yung mga pustiso and everything else?
Mm. Actually, what they helped us with was how we will be able to really start again, to get back with all of this in place. No? So that meant they helped us to make protocols for patients to follow and clinics to follow. Kasi we have an obligation to keep everybody safe. No? Kasi we're all in this together, hindi po pwedeng hindi namin gawin yon kasi we affect the whole community. Everybody affects each other. So they helped us make protocols, like for example, with patients, if before may mga walk-in, yung pwedeng pumasok lang,
Yeah.
hindi na allowed. Oo, hindi na siya allowed. Kailangan pag gustong tumingin sa pumunta sa dentist, kailangan naka-online, usually online booking. Pwede rin yung telephone call, but the thing is, the first level of screening would be when you make the online booking, may questions na doon. Which are, naka-question na doon. May screening questions na doon. And then, let's say, if they make the appointment a week before, and they want a certain date, it is still up to us to decide kung anong pinakamagandang date and time during the day. Kasi we will have to establish sino yung mga pupunta, kung ano yung pinaka-best time na pumunta sila. So there's an online booking where the first screening questions are asked, and they are requested to either agree or disagree. Kasi nga, if they disagree, then there's really nothing to talk about. No? They don't. Kasi we have to screen them as to if they had recently traveled, if they had recently got into contact with somebody who had been, had COVID-19, or suspicions lang, dapat mag-yes or no sila doon. And based on their answers, we can either refuse or allow visits.
The Manila Times interview with Dr. Ditas Dominguez. June 28, 2020.
Now, patients are just actually, from the feeling I get, they're actually happy with all of those in place. Kasi nga, they realize that everybody is really doing their part in helping while this is ongoing. So yun sa pasyente yan. And then, pag nagkaayos na dun sa schedule, online rin yan, what happens is we give them steps like we'll be sending them an email as to what the protocols are. So, hindi sila maninibago. So, pagdating nila doon, itong ine-expect, ganito. Katulad ng, in my office in particular, we don't want to have more than the patient appointed in the office.
I see.
Hindi sila pwedeng mag-antay. Ngayon, kung kailangan may kasama, pwede sila mag-antay sa corridor. Pero hindi po pwede sa reception area.
I see.
Siguro kung kunyari, basta kailangan ng kasama. So what happens with my patients is, pag dinadala sila, kung may driver, dinadala sila, tapos pag natapos sila, labas sila kaagad. So the exposure to anyone and everyone is limited. So as soon as they're done, tapos. They leave right away. So what else? Aside from that, of course, they on our part naman. So those are one of the things. No, there are many things that the patients have to get ready with. Mainly the screening. We have to know. In fact, the day before, we call them to ask again the questions. If kasi po pwedeng nag-iba yun within a week. You know, they could have been in a part, meet someone the day before, 2 days before. So ang protocol ko sa office is that I have my secretary call and do a verbal confirmation. Kung pare-pareho pa rin. Tapos on the part of the clinic also, we did a lot of changes kasi it was necessary. So operatory had to be changed. So basically, the patients are very cooperative naman so far. Okay naman.
Yeah. Doc, nag-enforce po, well, of course, some people or some physicians did rapid testing. Kayo ba,
Yes.
Doc, are you planning or do you do rapid testing muna on your possible on your patients po before they
No,
enter?
that is not that is not recommended, in fact, by PDA also. No? If you've done, most people would feel like sana gawin na lang lahat, kasi if you look at the nuances of actually the different factors that come into play when you do a rapid testing, there's so many. So the worst thing is that you could be given a false sense of security when actually there's a problem already. So what we should do is really be very strict with your screening process. The screening process should be very stringent. Hopefully, you've established enough trust with your patients kasi I've been seeing my patients for years, decades na. So we've established that trust. So we don't want to have each other get, hindi ba mapapahamak, di ba? So sana ganun yun para sa lahat ng yung maging honest sila sa kanilang mga symptoms and all that. So if I were to be asked, probably not unless they're symptomatic already. Kapag may konting alanganin, then siguro gagawin yun. But offhand, no. I would think that the best protection would be, or at least that would be to do the usual, hand washing, distance, physical distancing, what else? All of that's recommended.
Masks.
So,
Doc, it's like you're saying na parang it's a triage, na parang ganon.
Yes, the triage, definitely. Yes. The triage is good. You have to do the first and then the second. Para talagang, I think that's the most, under the circumstances, I think parang mas kaya yun kaysa the other one. Kasi you can't force patients to do to just do that. In fact, they'll go out of their way to do that. And sometimes the others will not allow them if they're asymptomatic. They can't give the reason na because my dentist wants them to have. Hindi. So what we do in the office in the clinic is, we just presume that everybody is an asymptomatic carrier.
See.
We just presume. So kami yung nagre-ready. So kami yung talagang naka-PPE, kami yung naka-ayos lahat. Tapos nun, the whole clinic is ready for them. So that's what we do.
Doc, ano yung mga dental services na pwede niyong gawin at hindi niyo pwedeng gawin during the community quarantine? Like for example, pwede ba yung dental surgery? Pwede ba yung mga braces? Pwede po ba yung mga root canal? Pwede po ba yung simpleng linis na po? Ano yung mga dental procedures na hindi pwede at pwedeng gawin during the quarantine period?
Yes. Now, for most people, probably it will be so a little complicated when we go into terms, no? Because each procedure kasi can entail so many things that can be done just to reach to one point of treatment. Okay? So, tsaka different styles. The thing about it is, the more important thing to know lang is that it should not be an aerosol generating procedure. Ano yung aerosol generating? Kung nakapunta ka na in your dentist's office, makikita mo doon parang madaming may spray. Yung
Yes.
spray ng tubig. Pag naglilinis ng ngipin mo, may spray rin yung ano namin, yung gumagano, di ba? Minsan natatalsikan pa nga yung mukha mo and all that. Pati yung aming drill, yung high-speed drill, may tubig rin yun. There's a reason why there's a spray because when we do procedures, we need to have, let's say, some coolness from the water. Yung mga ganon. So may reasons bakit may tubig yan. Unfortunately, these are the ones that cause the aerosols. And, para siyang may spray na maliliit sa hangin.
Droplets.
Yes, the droplets are the ones in the air and it stays there for a while. And that's the one, if the patient is indeed positive and there's a reason na ganun siya, yun ang mangyayari. Mas makakontaminate niya kami kaysa kami sa kanya. You know, so that's why we really make ourselves wear the PPEs, the face shields, the double masks, because the probability of them contaminating us is higher than we them. And therefore, if they contaminate us, they can also mataas rin ang in-between patients kung hindi kami maglilinis or magdi-disinfect between patients. Now, that's one of the things also that we had to step up. Kasi ang standard infection control naman talaga meron na yan sa dentistry noon pa. Okay, that's a given. Talagang linilinis namin, dinidisinfect, sterilize namin in between patients. But now, we have to have a little more time to really sterilize it. Now, in my office in particular, I have, what you call this, yung mga exhausts. Yung exhaust, kinukuha yung hangin. Kasi, most of the clinics kasi, if you notice, pagpapasok ka, merong area na reception area, waiting area. Tapos noon, maglalakad ka ng konti, nandun na yung operatory kung saan yung desktop chair. Doon na ginagawa lahat. Yes, no? Most of the time, if the clinics are a certain size, usually it's, ano lang, yung, what do you call that? You separate the rooms by partitions and butas dun sa taas. So parang the aircon moves around and all that. So now, the recommendation was to isolate or to separate. So gagawin mong kwartong hiwalay. Wow. So yung operatory is the place that work is done, and then the reception is where people wait. In this case, wala na nagwe-wait. Kasi kapag pasok niya, diretso na siya doon sa operatory. Ngayon, you have to remember that merong other people na nandoon, yung secretary, yung nasa labas. So dapat yung air sa labas, sa waiting area, dapat supposedly clean air yon. Kasi hangin sa labas. Yung air na magagawa sa loob ng kwarto na yon, sasabihin na lang natin, air that has to be cleaned. So it has to be sucked out, not out into the reception, but out of the room. If you have a window, even better. In my clinic where I have no windows, I had to put exhausts. The exhausts had to remove a certain volume of air rapidly within an hour. So there were exchanges of air para malinis parati yung hangin. Tapos noon, if you read the guidelines, PDA has recommended to do filters ng hangin. So the air enters the filter, cleans the air. If there's any bacteria or virus, filters it, sinasala niya. Tapos nun, may UV light pa yun sa loob ng unit. So, pagkasala niya, papatay niya, syempre, para yung hangin na lalabas malinis. Diba? So, yun yun. Oo, yung dagdag na. So, we had to get hold of that. We had to buy those purifiers, no? And then
additional investment po, Doc. Parang additional investment.
Yes, additional yun. But you know, kailangan eh. I mean, kawawa naman yung kawawa tayong lahat pag hindi
Mhm.
tayo nagganyan. Kailangan. So, the good thing is at least there's a little naman to go around and I was able to get naman a few of the things. So, ayun, we got it ready, the office. That's just one of the things that we did in the office. Like, I think most of the dental clinics now have realized, kasi with the PDA's guidelines also, that UV, yung ultraviolet light, alam mo yon,
Yeah, yeah,
yung
yeah.
intense. Yes, that one
Sterilizers.
can, yes, it can sterilize. So what we do is in between patients, nag-on kami ng UV para patay lahat ng, yeah. So we disinfect, punas-punas everything, with our disinfecting solutions, and then we turn on the light. So in between patients, meron talagang waiting time. Kasi hindi kakayanin yung sunod-sunod lang. Dapat it should be at a certain number of minutes. Ayun. So far, it's working naman. Siyang dance. So we just have to perfect the dance. So far so good. Cooperative naman lahat ng patients.
The Manila Times interview with Dr. Ditas Dominguez. June 28, 2020.
Dati po kasi, after nung normal times, before ECQ, parang pila-pila lang. After nung isa, next patient ulit. Then after nung isa, next patient.
15 minutes, 10 minutes, 15 minutes, yeah. Ngayon, aabot ng 45 to an hour, depende. So, nabawasan talaga. So, usually, if before, especially on weekends, I'd see 10 to 12 patients in a day. Ang nangyari, ngayon 4 na lang.
Wow.
4. Oo, 4. Kasi, we did already that, and that's recommended also, mga 4. Pwede 7, siguro, mga 6 to 7, pero hanggang gabi na yun. And for me, I'd rather just keep it at a steady 4 para everybody's seen and we're also protected. We don't stay too long in the workplace. So, ayun, we have specific times during the day na available na siya. So, nabawasan by 70% yung number of people. In my case, parang I see 50 to 70% less of patients now. Kasi nga, ang baga, I mean, we have to do all of that for patients. Diba? So, that's what it is.
People would say na baka naman po magkaroon ng parang negative insight, yung mga negative insights sa mga tao na baka magtaas ang presyo ng kahit konti dahil sa additional na safety protocols, PPE. Is it okay lang po? Is it, should we say na it's worth it po ba yung katiting na price increase as opposed to the safety that you're giving to your patients?
Yes. Actually, if you ask me personally, it's worth it. I mean, really, the amount of time we think about how to keep our patients safe, the way we, procure it, it's not easy. So, I think if you ask me, like I'm a patient to other doctors too, medical doctors, no? And if it comes to that, I'm okay with it. Wag lang exorbitant naman. And I don't think at this time there are those that will take advantage. I think people realize that we're all in it together. So walang lamangan kasi hindi tayo uusad niyan, di ba? So what happened also, the good thing also that PDA did was that they got together and they kind of decided also what were fees that were fair, If there's any increase, maliit lang, fair yung fees. Kung iisipin mo talaga, no problem, So, at saka, you can always naman talk to your dentist. I mean, hindi naman yan, iba, di ba? So, kung sa tingin mo, dun lang kaya mo, or you can do like, that's for me, personally. So, through the years, I've had that too. So, I'm not, wala namang hindi pwedeng pakiusapan. Like, if there are big fees, you can do, you can do deferred, mga ganun. But if you're asking me if it's fair, the amount that is increased for the safety, oh yes, definitely. Kasi ang laki ng outre namin eh. Hindi naman namin pinapasa. Ako, hindi ko iniisip yon. Ang iniisip ko lang, dapat safe lahat ng pupunta sa office ko. At saka safe kami nung staff ko, di ba? Dapat ganun yun. Kasi we have a moral obligation to our patients.
Speaking of staff po, of course, you had staff na sinasweldohan po. How did you how did you able to help them po, especially during the time sarado po yung inyong dental, yung office?
Oh, yes. I think each dentist or employer did whatever they could, under the circumstances, kung ano yung kaya nila. For my part, what I opted to do was that I gave them an allowance on a daily basis, even if there was no work. Kasi I knew they needed it naman. I mean, so it was a daily thing that was transferred to their online, yung banks, tas sila nalang kukuha nun. So meron silang pang araw-araw. Kasi wala talaga eh. Ano magagawa mo, di ba? So ganun lang talaga yun. So on my part, that's what I did. I gave them an allowance every day. Parang, we didn't call it salary eh, kasi it wasn't salary. It was like an allowance for them. So that's how I think I helped them.
And of course, Doc, I heard po na the UP Medical Dental Society at had an telehealth program.
Yes. A lot of my classmates were there also. Part of it.
Of course, yung telehealth, telemedicine is very important po during the COVID-19.
Yes.
Of course, how did telemedicine, of course, there are pros and cons about telehealth kasi, of course, the pros is the patient will contact you personally to ask about their problem. Then, of course, the cons is, of course, you cannot give judgment to the patient kasi hindi mo sila nakikita eh. But
correct.
So how do you outweigh the pros and cons of telehealth in terms of dentistry?
In terms of dentistry, well, of course, we should always put it in the context of now. What's happening now. So basically, if you think about it, it's a good thing they have the telehealth because it will lessen at least the worry, the anxiety, pain. Yes, also if they will be able to prescribe, for as long as there's photos. Kasi sometimes they, like me, when some of my patients got in touch with me privately to ask me about certain things, really request ko, can you please take a photo so I can see? Although, of course, that does not take that does not take the place of actual intraoral. Makikita mo yung gum, kung gaano kapula and all that. But at least it will give you a picture, of that. So you can kind of get, make the best assumption based on the symptoms kasi kausap mo naman yung pasyente, may symptoms naman yan. And if you have enough of experience and your clinical eye to see there, you can ask them certain questions also, like, for example, what is the feel? Is it fluctuant? Is it malambot, matigas? So it's cooperating with each other. And I think it's good that there was a telemedicine kind of that yung parang help for most people. Okay, so
ayun. So Doc, any final thoughts na lang po, or finals? Of course, people still right now quarantine pa rin po, mobility problems aside. I think some people are still somewhat scared pa rin po going to the dentist.
Of course. Yes.
There's still aversion pa rin po. Not just only for dentists, but for any medical malady.
Yes.
So
yes, that's right. My message to them is, you know yourself, you know exactly what will be good for you in terms of if you're ready to go, if you think your symptoms need attention right away, like if you're in severe pain, then please go ahead and contact the dentist that you trust, or the medical provider or health provider that you trust, so that you can get whatever advice that you can. Just remember that we're here to help, And although we are also like you, we're also anxious about all of this and the things that are happening. We are doing our best to keep everybody safe, and healthy and well. So let's help each other while this is ongoing, and be cooperative. Everybody has just to cooperate. Ganun lang naman yun. When you go out, wear your masks. You stay away from people, physical distancing, 6 feet away, 2 meters away kung maaari. Hindi mo naman kailangan lumapit-lapit doon, and then you cough. If you need to cough or to sneeze, you have to have, you should know where to cough, your elbow, and all that. So just do your part. We'll do our part. We have to do our part, all of us, so that, we can weather this. And I'm sure this will pass too. Hopefully soon. And that's it. Yun lang ang masasabi ko. But come at your time. Kung ano yung time na okay na for them, hindi mo mapipilit kasi yan eh. For each person, iba-iba. So, basta we're just here. We're just here to help when you need help.
Again, Dr. Ditas Dominguez, thank you very much for your insights about the dentistry profession. Of course, during the time of COVID, alam po natin na it's a very difficult time, especially po, not just yung may mga sakit sa ngipin na nangyari during the ECQ. I know na napakahirap isipin na you're going to sleep with a very bad tooth, especially walang doctor.
Yes. That's right. Oo nga. So, yeah. So at least, just contact your dentist. I'm sure they'll be open to talking to you and making things better for you, whatever that may be.
Thank you po ulit, Doc. Thank you.
Thank you, Renred. Okay.
The Manila Times interview with Dr. Ditas Dominguez, June 28, 2020.